in Focus Spotlight from Memorial Cancer Institute. It is my pleasure to introduce our Practice in Focus, being represented by clinical pharmacy specialist Christina Barra. She'll be speaking a little bit about her practice and why she joined NCODA and how her team are partnering with NCODA now and how they'd like to do things in the future. Christine?
Hi, good afternoon. My name, as you mentioned, is Christine. I just wanted to talk about our practice here at Memorial Cancer Institute. And I'm really grateful for you guys for having me. So here at Memorial Cancer Institute, our mission is to heal the body, mind, and spirit of all of those whom we come into contact with. And we do that primarily through practicing patient-centered care, putting the patient first. As far as our pharmacy services here at MCI, we have a specialty pharmacy which is located off-site. The specialty pharmacy is the one that fills most of our oral oncolytics. They also fill some of the supportive medications as well. On-site, we have a retail pharmacy. This is where we fill a lot of our supportive care medications. So pain medications, antiemetics, things like that are filled at the retail pharmacy. Something else to note, the specialty pharmacy fills the medications and either will through mail order or the patient can directly pick them up as well on site. As far as our pharmacy service staff here at Memorial Cancer Institute, we have a couple of different sites. So we have a total of 4 infusion centers and 7 pharmacists that are covering these different centers. As far as our oral oncolytic counseling clinic, we have 2 pharmacists, one at each of the major sites, which are responsible for running and managing these oral chemo clinics. And we also have a BMT pharmacist. That pharmacist is more so in charge of our BMT patients, monitoring levels, making sure that those patients are all on the correct supportive care regimens, as well as bone marrow regimens. As far as technicians, we have 5 technicians whose primary role is to prepare chemotherapy. So they're mostly in the hoods, compounding hazardous as well as non-hazardous medications. And we also have 3 pharmacy technicians that act as pharmacy reimbursement specialists. So their role, they work pretty closely actually with the pharmacist in the oral chemo counseling clinic to ensure that the patient is able to get monetary support or enroll in any kind of patient assistance programs in order to streamline treatment and get the patient treated as soon as possible. As far as partnering with NCODA, we've really looked to it to partner up with our quality standards. We've been using the oral chemotherapy education sheets and handing those out to our patients in order to empower them and make sure that they're on top of care. NCODA also has a patient advocacy focused mission, and this really aligns with our goals and missions here at Memorial Cancer Institute. And NCODA also provides opportunity for us to understand how health systems and different dispensary settings can collaborate and partner together and advance patient experience, especially with regards to our oral specialty treatments, which, as we can all see, are becoming more and more common in our patients these days. So we've gotten a lot of use out of those oral chemo education sheets and keeping informed on current events with regards to oral oncolytics and such through partnering with NCODA.
Thank you so much, Christine. And for anyone else that would like to be a practice in focus being spotlighted on our webinar, feel free to email us at contact@ncoda.org and we'll get you set up.